Hi, I'm Dr. Nicole Sommer. I'm Associate Professor for the Institute of Plastic Surgery at SIU School of Medicine. In the time of the COVID-19 pandemic, it is very important that we follow CDC guidelines and we do not perform elective procedures. These guidelines are set out to protect patients, healthcare workers, and the community at large. In situations where procedures are being done that are putting us at risk, this can also spread to the community. SIU has been at the forefront of making sure that all of these elective procedures have been stopped, and we are only performing emergent and urgent procedures, and we've been doing this now for the last 2 to 3 weeks. And we will continue to do this up until at least April 30th, if not longer, depending on what the governor and the CDC decides going forward with what happens in Springfield with the virus. What I wanted to explain today is the importance of us continuing to do that and why we do that, and what does that actually mean, an elective procedure versus an emergent procedure. An emergent procedure would be something you'd have done because you had an injury. You hurt your hand on a chainsaw or a table saw. You have a burn. You burned your hand on a pot when you were cooking. Those are going to be things that you would come to the ER for, go to your doctor for, and then we would see you and we would take care of those things. It may also be something like a very bad cancer that needs to be taken care of now because it will do you harm for us to wait to take care of that. Those are all emergent procedures, things that need to be done and taken care of now so that it will not bring you harm later. Anything elective is going to be a procedure that you can wait to have treatment, say a small skin cancer on your cheek, screening for a possible colon issue, or screening for your breasts, a mammogram. A follow-up visit from a hip replacement or a knee replacement that you had a few months ago. Those are all things that are not visits or procedures that need to be done right now. Those are all things that can wait 2 weeks, 4 weeks, 6 weeks, and you will be fine if you wait on those. Now, what we can offer is if there is something that you are concerned about, say you do have a skin lesion that you're not sure if that's something that you should worry about or not, there is an option for telehealth where you can contact the office and you can set up an appointment with one of the doctors, and they can video chat with you and look at your problem, and they can talk to you about the probability of this being an issue and if this is something that we can wait on to take care of when it is safer to do that, or if it is something that we need to deal with right now. But the most important thing is that emergency procedures and urgent procedures are the only things that should be being done by surgeons at this time. There should not be any other procedures or office visits done unless they fall under these categories, because the more exposure that there are to people in the community because of these visits, the more chance that this will continue to be an issue for us, and we will continue to be in the stay-at-home process longer because of it. So the sooner we can get this under control, the sooner we can all be back to our normal lives. And I believe that this is a big component of that, is making sure that we are keeping this under control by eliminating all care unless it is urgent or emergent.